Give you a few seconds to see. Welcome, everybody. I'm Michelle Berry, Senior Associate Dean for Global Health and the Director of the Center for Innovation of Global Health. I'm just going to say a few words and then introduce people. As we come off the Martin Luther King weekend, I want to remind us and take pause and think of the book that he wrote 50 years ago to the day, whose title is Where Do We Go? From Chaos to Community? And then also pause a second to reflect upon the new Oxfam fact that 8 people own 50% of the wealth of the world. And I guess what I see as this research convening day is that we are coming together as a community of Stanford Global Health, and hopefully we can bring some order to the chaos and polarization that we're seeing globally and in our country. So I would like now to actually invite Dean Lloyd Minor, who has been a great supporter of Stanford Global Health, and he's going to kick off the day. We have a really great research convening day with posters and speakers. And Lloyd, thank you very much for coming.
Well, thank you, Michelle, and thank you everyone for being here today. I've had an opportunity this morning to see many of the posters and visit with many of you and share in the enthusiasm that I know we all have for the initiatives in global health here at Stanford University. I'm really pleased and honored that we shepherd these through the School of Medicine, but I also want to make it clear that I very much view it as a university endeavor, and I want to thank Michelle Berry. Michelle, I have the honor of working with you as Senior Associate Dean, but all of us at Stanford benefit from your leadership across all the schools and institutes at Stanford. So just a few thoughts as you launch today, and I want to sort of capture those thoughts perhaps in our overall strategic vision in Stanford Medicine in what we call precision health. Now, you've all heard of precision medicine, and precision medicine, the initiative, really it has its roots actually here in the Bay Area. Shortly after I arrived in the fall of 2012, Sue Desmond-Hellmann, when she was chancellor at UCSF, hosted a conference on precision medicine at UCSF. And this conference brought together thought leaders from around the country. And then this gradually made its way into a discussion in discussion groups in Washington. And then about a year and a half later, President Obama announced a precision medicine initiative. And precision medicine is what really all of us in academic medical centers in one form or another are doing today. And that is using genomics, big data science, regenerative medicine, and applying those enablers to the diagnosis and treatment of severe acute diseases like cancer, heart disease, neurological diseases. And we're seeing the amazing benefits of this revolution in precision medicine. We're seeing more effective targeted therapies for cancer. We're seeing this incredible renaissance in immunotherapy for Stanford, all very much derived from precise, individualized approaches to designing and in many cases developing personalized therapies for each tumor and each individual. And we for sure do precision medicine here at Stanford. And we've made a lot of investments these past 4 years in building out our capacity in precision medicine, particularly in the cancer arena. But we view our unique opportunity here as using precision medicine as a foundation, but not stopping there, and really taking it to a very important next level. And that next level has to integrally incorporate global health. And that next level really involves developing precision health, using the same enablers of genomics, big data science, technology enablers, regenerative medicine, and applying those in a predictive, preventive, and proactive way so that we're able to prevent diseases before they occur, Or when we can't do that, diagnose those diseases much earlier and therefore treat them more effectively with fewer side effects and complications. Now, for precision health to be a reality, we also have to firmly embrace the notion that health is much more than genomics and medical care. If we look at a pie chart of health overall, roughly 20-25% of our health is determined by our genetic makeup. And with the exception of a few things, although it may be more in the future with CRISPR-Cas9, there's not a whole lot we can do to change that. And then another 20% or so of our health is dependent upon the health care and the medical care that we receive, at least we living in a developed country. And then the rest of health, namely 60-70% of health, our health as well as the health of individuals around the world, is determined by environmental, social, and behavioral factors. The vast majority of the determinants of health lie in the arena of social determinants, environment, and our behaviors. So how do we embrace that in terms of a vision for where we can have impact as an academic medical center? You know, most academic medical centers are focused on, ourselves included, are focused on the ultra-tertiary and quaternary end of care. And for sure, we are and we want to remain the place that offers hope where other institutions and other healthcare arenas are not able to offer that hope. But we can't stop there. We have to take the same powers of innovation, the same technology enablers, and leverage the resources at this great university to have impact on health in the broadest sense. And that's where the Center for Innovation in Global Health and what's going on in global health at Stanford has such a critically important, absolutely essential role. Because for us to make, and we've actually gone beyond sort of a statement of being predictive, proactive, and preventive. There's 7 different themes in precision health, and one of those themes is social justice, for example. Another theme is related to the environment and the impact of factors associated with the environment on health. So if we're really going to lead, and we have the capacity to do so, on innovation in health and impacting the health in our society and in the world, the issues that you're going to be hearing about today and the work that is displayed in the posters and in the talks today are of absolutely critical importance. And there's never been a better time to do this. Last night at the dinner, we had a wonderful talk by a graduate student here in mechanical engineering who has developed a smartphone app to record the wing beating and the noises emitted by mosquitoes, and from that, and doing signal analysis, to be able to determine the type of mosquito that is making the noise. It's doing the chirping, or as Michelle pointed out, the tweeting, but in a different sense. And just think of the power of that. In 2020, 80% of people on the planet will have access to a smartphone. 80% of people on the planet. And I was chatting with her afterwards, and I said, well, you know, making these recordings, do you need a really, state-of-the-art iPhone? And she assured me that no, just the cheapest cell phone you can find will enable you to do the recording. Think about the power in crowdsourcing, 80% of adults on the planet having a smartphone, about how we can really track the migration patterns of mosquitoes if we get, people involved in doing the recordings, uploading them, and then doing the analysis. That's just one example. Other enablers that are coming out of Stanford, the Foldscope, lots of other things. The developments going on in virtual reality. Virtual reality headsets are now less than $100. That totally changes the way we can do medical education around the world. I mean, we can do real-life simulations of surgeries and of training of surgeons now in a very cost-effective way. And we can have our faculty sitting here in Palo Alto interacting with people on different continents in different areas of the world. So the possibilities are endless. And we're limited only by our imagination and by our energy and enthusiasm. And I think we all know that at Stanford, those are rarely limiting. And they shouldn't be limiting here as we come together to leverage the tremendous assets that exist around Stanford and global health and apply them to making this world a better world and to making precision health not only a dream, but a reality here at Stanford and around the world. So congratulations. I hope you have a wonderful day. I know the talks are going to be great, and I wish you the very best. And Michelle, thank you for your leadership.
Thank you so much, Lloyd. Thanks for coming. Thanks for looking at the posters and talking with some of the young scientists. And thanks for helping to connect this effort on precision medicine with the objectives of Stanford Center for Innovation and Global Health. I'm going to ask for another leader from the campus to come forward. Chris Field is director of the Woods Institute. And if I went through Chris's CV, we would blow the timetable for the whole convening today. So I just want to highlight that he has been working at the Carnegie Foundation, but moved over to become director of the Woods Institute last fall. And the Woods Institute for the Environment is interested in using world-class science and helping to solve the big environmental problems of our time. So there is a lot of overlap, and I think that there is an element in Chris's background that I want to particularly highlight, and that is his leadership on the Intergovernmental Panel for Climate Change. And what this shows is not only that he is a top-notch scientist, but that he is committed in terms of converting that work into effort in the world to protect the environment. So we are very pleased to have a close relationship with the Woods Institute at the Center for Innovation and Global Health, and I would invite Chris up to say a few words.
Thank you, Steve, so much, and thanks, Michelle. Thanks to all of you for the science and the leadership that you've brought to, defining challenge of our era. I'd like to speak to just 3 simple themes this morning that I think highlight the challenges we face and the opportunities for making real progress. At the Woods Institute, our motto is practical solutions for people and the planet. And we're really struggling with trying to come up with ways to understand the environment, human-environment interactions, and the kinds of technologies, the kinds of philosophies, the kinds of social science that are relevant to addressing those. And as I thought about the relationship with the Center for Innovation on Global Health, really 3 things that come into very sharp focus for me. The first is that there's so much we can learn from the medical community, from the health sciences community. And it really starts with the fact that in medicine, the goal is solving problems. In so much of academics, the goal is understanding problems and hoping that somebody else comes up with a solution. And at least for me, this transition from really thinking about what the nature of the problem is to the nature of the solution is really transformative. And it's something where across the natural and social sciences, we have so much to learn. So much to learn about system-level thinking and understanding that there could be several steps between cause and effect. The importance of being able to step back from a problem and appreciate that it may be very difficult to understand the things that are going on. The fact that there are some kinds of problems that just don't get solved, and that you need to deal with the sociology and the psychology of kinds of problems that can't get solved. I've just been deeply impressed at the extent to which the health sciences community has things to offer to the environmental science community that we haven't really capitalized on. But equally, there are a wide range of areas where the environmental sciences community has important things to offer to the health sciences community, and that's the second theme that I wanted to share just a few thoughts on. Within the Woods Institute, especially in collaboration with Steve and others, we've already seen dramatic progress in lots of areas of using environmental science to help solve health sciences challenge. Julio DeLeo's work on addressing intermediate vectors in schistosomiasis is a really beautiful example, or Manu Prakash's work on understanding the how you can predict mosquitoes based on the wing beat frequencies. They're just a place where we know very clearly that health outcomes depend on environmental processes, and that if we can intervene at the scale of the environmental process, we have a tremendous opportunity to decrease the responsibility of dealing with the issue at the health sciences end. But what I really want to talk about is kind of a third theme, and it's the theme of synergisms that come from thinking about health outcomes and environmental outcomes in the same sentence. And I think that's where the tremendous potential for innovation is. I think it's where we're really uniquely positioned on the Stanford campus, and it's the main reason that I was so excited to have a chance to share some thoughts with you today. When I think about global sustainability, I can't really separate sustainability of environmental resources from sustainability of the human enterprise. Can't separate sustainability of the human enterprise that has components due to well-being and economics from health outcomes. And when we think about the nature of the connections and the magnitude and complexity of the interconnections, it just becomes so clear that we need to take a holistic problem to a holistic approach to the challenge of health and environment. And the opportunities are just incredibly rich. Genomics and big data open new doors. Understanding the sociology and the psychology of the way people interact with the environment, the way they interact with other individuals, and the way they interact with their own health, all are incredibly rich. The essential goal of the Woods Institute is to bring together scholars with very different backgrounds to solve challenges that are so complicated that a disciplinary approach simply doesn't work. And I think that concept, the concept of bold interdisciplinary, is really intrinsic to the health sciences. But I'd like to present all of you with the challenge of really expanding that, and expanding it dramatically in years and decades ahead, to recognize that the sustainability of the human enterprise really depends on the sustainability of the global enterprise, and the sustainability of the global enterprise depends on the sustainability of the human enterprise. Today, there'll be a whole bunch of presentations and posters that deal with individual aspects of that, and at least for me, the knowledge that that's happening is really inspirational, and it really encourages a whole new generation of thinking about ways to capitalize on the opportunities for the complementarities between taking a health sciences approach and an environmental sciences approach. So I wish you all the best with this endeavor, and I'm keen to be a participant and an applauding fan of the things that are coming next. Thanks so much.